Lumbar stenosis is a condition where the spinal canal and the lower back lumbar region narrows, putting pressure on the spinal cord and nerves. This narrowing can lead to symptoms ranging from mild discomfort to severe pain and disability. Lumbar stenosis is commonly associated with aging but can also result from other factors such as injury or genetic conditions. Causes of lumbar stenosis: degenerative changes. Osteoarthritis. The breakdown of cartilage in the spine can lead to bone spurs that narrow the spinal canal. Disc degeneration. The intervertebral discs lose hydration and elasticity, leading to bulging or herniation that can compress nerves. Spinal instability. Spondylolisthesis. A condition where one vertebra slips forward over the one below it, potentially narrowing the spinal canal. Congenital factors. Some individuals are born with a narrower spinal canal, which can predispose them to stenosis. Injuries. Trauma or injury to the spine can lead to changes in spinal structure and stenosis. Tumors or cysts. Benign or malignant tumors and cysts in the spinal canal can contribute to narrowing. Paget's disease. A bone disorder that can lead to abnormal bone growth and spinal stenosis. Symptoms of lumbar stenosis. Symptoms vary depending on the severity of the condition and the degree of nerve compression. Lower back pain. Persistent or intermittent pain in the lower back. Leg pain. Pain that radiates from the lower back down the legs, often referred to as sciatica. Numbness and tingling. Sensations of numbness or tingling in the buttocks, legs, or feet. Weakness. Muscle weakness in the legs, which can affect walking and balance. Pain with walking. Pain may worsen with walking or standing for extended periods, often relieved by sitting or bending forward. Changes in bladder or bowel function. In severe cases, there may be changes in bladder or bowel control due to nerve compression. Diagnosis: medical history and physical examination. Reviewing symptoms, medical history, and performing a physical exam to assess movement, reflexes, and muscle strength. Imaging studies. X-rays can show degenerative changes, bone spurs, and misalignments. MRI magnetic resonance imaging provides detailed images of the spinal canal, nerves, and soft tissues. CT scan computed tomography offers cross-sectional images of the spine and can help in evaluating bone structures. Electromyography (EMG) tests the electrical activity of muscles and nerves to assess nerve function and identify areas of compression. Treatment and management. Conservative treatments. Physical therapy. Exercises to strengthen the back and improve flexibility and posture. Medications. Pain relievers such as NSAIDs, muscle relaxants, and corticosteroids to reduce inflammation and pain. Lifestyle modifications, weight management, activity modification, and ergonomic adjustments. Interventional treatments. Epidural steroid injections, to reduce inflammation and pain around the affected nerves. Facet joint injections, to relieve pain in the facet joints. Surgical treatments. Laminectomy, removal of the lamina, the bony part of the vertebra, to relieve pressure on the spinal cord and nerves. Foraminotomy, removal of bone or tissue that is compressing the nerve root. Spinal fusion, joining two or more vertebrae together to stabilize the spine. When to seek medical help if symptoms are severe, persistent, or worsening. If there are significant changes in bowel or bladder function. If there is significant weakness or difficulty walking. Conclusion: lumbar stenosis can significantly impact quality of life, but a range of treatment options is available to manage symptoms and improve function. Consulting with a healthcare provider is essential for an accurate diagnosis and to develop a tailored treatment plan based on individual needs and the severity of the condition.